Or recap, Saturday, May 9th, there were no new cases of COVID-19, leaving Chautauqua County's total at 42. At that point, we had received 1,294 negative test results. On Sunday, there were no new cases. And again, on Monday, there were no new cases to report. Tuesday, there was one new case, bringing our total to 43. On Wednesday, there were no new cases. And yesterday, we reported no new cases. Today, we have two new cases to announce, both females, one in her 60s and one in her 70s. This brings our county total to 46 confirmed. Currently, we have 9 active cases in Chautauqua County. 33 have fully recovered. Unfortunately, during this time, we have had 3 fatalities. Today, we have 149 individuals under quarantine or isolation orders and are being monitored. And to date, we have had 1,656 tests returned in Chautauqua County as negative for the COVID-19 virus. As I said before, today I'm joined with my COVID-19 response team due to the numerous topics we would like to cover today. Throughout the crisis, my team has met with myself every morning to discuss the current situation in Chautauqua County and are formulating plans and processes to mitigate the impact of the virus on our community, ensure our healthcare systems are prepared, and the community is looking at the beginning to reopen when the governor allows. When we make a decision as a team. Much discussion and weighing all options takes place, and I'm proud and quite humbled at the dedication and quality of our local COVID-19 team, who are second to none in the experience and expertise they bring to the table for our residents of Chautauqua County. First of all, I'd like to begin by looking at the Chautauqua County scorecard. You'll see this on many different references, on different press releases throughout. Per Governor Cuomo, the Western New York region is not ready to begin reopening under Phase 1. And in fact, we moved in the wrong direction yesterday by meeting only 4 of the 7 metrics needed to reopen. However, if you look at Chautauqua County's metrics, we can meet all 7 of our metrics. Chautauqua County has met all metrics related to hospitalizations and hospital capacity. Our contact tracing has been robust throughout the COVID-19 crisis, and we surpassed the governor's expectation of 30 per 100,000 residents with our current capacity. As well, I have a plan to phase in or shift additional staff to contact tracing if the situation arises. I'd like to thank personally Congressman Reed, who has been able to broker a deal with Quest Diagnostics, a public and private partnership, to increase the required testing capacity to meet this metric as well. Another thing that took place today was I have initiated discussion and efforts to work with leadership in Cattaraugus and Allegheny counties to look at our metrics together and urge the governor to look at us as a sub-region. We're not declaring independence, but we are looking to ask them to look at our numbers and the current situation we have and the uniqueness of all 3 counties, Chautauqua, Cattaraugus, and Allegheny. The population density is limited to COVID statistics in this southern portion of the western region, and we're asking that we could be considered into reopening Phase 1 today, more so than being linked with the urban centers in the western New York region. There's also a great deal of economic commonality across the 3 counties in this subregion and the challenges we all face. Not only have our small businesses and residents been hit particularly hard by the pause restriction, as other regions start to begin to open, people have more options, and we are fear of pushing them out of our local counties and into other counties' economies. Chautauqua County is less than an hour drive from Erie, PA, and about 2 hours drive from Cleveland, Ohio. And across our subregion, Allegheny County is facing 5 of the 6 counties that border them, opening up 2 of those counties in Pennsylvania, with the Finger Lakes and Southern Tier regions opening today and Pennsylvania neighbors to the south opening in earlier May. Only Cattaraugus County, their bordering county, is not able to open as they are in the western New York region. It's critical that we work together, have a loud, unified voice with our governor's office to allow this subregion and to be open-based to our metrics and our public health capabilities. With me today, again, as I said, is Public Health Director Christine Schuyler, County Physician Dr. Burke, County Medical Director Brian Walters on the conference line, and John Griffith, our Emergency Services Director. I'd like to address a little bit, at this time I'd turn it over to Christine Schuyler, our Public Health Director.
Thank you, County Executive Wendell. As the County Executive has said, we really are very proud of the effort we've put forth in Chautauqua County. I am very pleased to have my colleagues here with us today, and knowing that every morning we meet with Dr. Burke, Dr. Walters, Dr. Falk, John Griffith, the County Executive, and myself, and we go over our situation every day. We have a great working relationship with our other county agencies as well as our community partners, and I think that is helping us to get as far as we've gotten in our response. Also in talking today with my fellow public health directors of Cattaraugus and Allegheny counties, we really have noticed that the prevalence of COVID-19 has been low throughout all three of our counties. Intense community mitigation strategies were enacted not to eradicate this virus, but to slow the spread of disease. The low rates of disease in our three counties demonstrate that those strategies, as well as our inherently low population density, have worked. I feel that we can naturally expect to see more cases as things reopen. People are going to be moving about more, and we are having more testing done now because of increased testing capability. So we are naturally expecting to see more cases. But as I said, a goal here has never been to eradicate the virus. That's not possible. Our job really is to slow the spread so that our healthcare system can manage those who are ill. We feel that we have the capability within the Chautauqua, Cattaraugus, and Allegheny health departments. We possess the expertise and capacity to adequately manage disease investigation and contact tracing throughout this pandemic.
Thank you. At this time, we'd like to turn the microphone over to Dr. Burke, our county physician.
Thank you, PJ. This is one of those situations where if we had a crystal ball, we could probably figure out what is going on very easily. But we're faced with some competing interests, data that we've gathered about a very novel virus. We have no historical data to really deal with except for 1918 and a couple of brief experiences with MERS and SARS and H1N1. This being said, the initial response was somewhat a crisis management response. Mitigation strategies had proven successful elsewhere in the world. We have very limited testing, no medication. Treatments were being tried and failed or proved to be less than successful, significant deaths. And so mitigation strategies were employed in a blanket sense across the nation. What we've learned over the last 12 weeks approximately is that mitigation does blunt the spread of the disease, but it is in our community and probably will continue to circulate in our community until such time as we develop, in quotes, herd immunity. We do not have a vaccine, and even the most optimistic guesses that when we'll have a vaccine are still months, if not half a year to a year away. Treatment, again, very limited. One medication which may work in very ill people is in very short supply. So what we're faced with is the decision of how we deal with a faltering economy and yet a disease that can prove fatal, as we've seen in now 86,000 Americans, plus the excess deaths that we're seeing associated with the disease, which probably puts the amount of mortality closer to 100 to 110,000. In thinking about it, we have to think about the fact that Chautauqua County uniquely, if you look at it, represents what's going on in the state, and the state represents what's going on in the nation. We have areas of extremely low prevalence like Chautauqua and Cattaraugus and Allegheny County. We have areas of extremely high prevalence, the more densely populated areas. The state has the same, so Chautauqua County has an area where most of our cases are. The rest of the county is rural, very low population density, and has very, very few cases. The state, exactly the same model. We have areas of extremely high density, extremely high prevalence. The rest of the state, northern New York State, the Adirondacks, and this western region, except for Buffalo, extremely low prevalence. And then you have the nation, which is exactly the same picture. Montana, with very few cases. Probably Idaho, same thing, except for the larger population centers. And yet, Los Angeles, New Orleans, Philadelphia, Buffalo, New York City, all high population density, all high cases. So the question then becomes, how do you begin to open up when you have this disparity in prevalence, and how can you do it safely? I think, as PJ and Christine have identified, we have looked for the last 8 weeks at what is going on here, and there's no question that we are continuing to have cases dribbling in a couple at a time. The case or the contact tracing has been excellent. We're very well equipped to do this. The number of hospital beds that are open, ICU beds that are open, medical staff that are trained and ready to accept cases if they're necessary, it's all there. And so then comes the question, are we ready to open, at least to begin with? And probably the answer is yes. We have things to work out, childcare, kids, what do you do, kids at home, a variety of issues that really need to be dealt with in order to have people safely go back to work. And probably not everybody who's out of work will be able to go back to work immediately. Some industries may have to wait their turn until the valve is turned open a little wider, and we get experience to see what happens when we open up. But I think overall, we have proven that in a low prevalence area, we are ready to take the next step. And I think there's been a lot of work done. I know that PJ is meeting almost on a daily basis with industry. The industry groups are meeting to look at how they can mitigate risk. And all this being said, you know, it is obvious that we are able to move ahead with this while being very cautious and probably expecting a bump up in some cases, but we're ready for that.
Thank you, Dr. Burke. At this time, we turn the mic over to Dr. Walters, who's called in. Dr. Walters, if you'd like to say a few words.
Thank you, County Executive Wendell. I think the only thing I want to mention is just to echo Dr. Burke and Christine's remarks that we know that when we start to open up our businesses and our economy a little bit more, we're going to see some more cases in the community. Our goal was to try to flatten the curve, and we're all very familiar with those ideas to try to make sure we don't exceed our healthcare capacity in our hospitals, our physicians and primary care practices, and that we don't exceed our PPE supplies. And we've done that very successfully. And as we start to pivot and look towards the future, as we open, we know we're going to see some increased cases, and that's okay. I think the reality is we were fortunate in this county to this point to have a low prevalence, and that's given us time, almost 2 months now, to really put the plans and preparations in place to be able to accommodate, handle, and respond to these increased cases safely in the community. And I think that's an important message for everybody in our public to understand is we have our EMS providers, law enforcement, emergency services, the health department, hospitals having capacity, physicians in our area, and our primary care providers all ready and all have been actively engaged in the process throughout the last couple of months to make sure that as we open, we're prepared to keep the public safe, to address any concerns that come up, to continue to monitor the situation so that as we move into these phases of reopening, we can do so safely and know that our public will be taken care of as we go forward.
Thank you, Dr. Walters. This time, we'd like to turn the mic over to Director of Emergency Services, John Griffith.
Thank you, Mr. Executive. I'd like to report that as far as the Office of Emergency Services, we've done extremely well. Working with the County of Chautauqua, working with New York State Homeland Security and Emergency Services to acquire the personal protective equipment needed to supply the first responders and healthcare workers in Chautauqua County. We will continue to do that. Our paramedics have worked along with the Chautauqua County Health Department and Christine Schuyler to do swab testing for COVID testing at testing sites. We're very pleased to have supported Christine in the work that she has done, along with County Executive in the work that he has done. The group that meets mornings, the County Executive mentioned, has been very focused on different aspects of how the response from the county would be taken during this time. And we do feel that now we have reached a point with PPE, with supplies, with training, and the other factors that go along as far as the first responders, the medical professionals, to a good place with this, this pandemic as it stands today.
Thank you. Go ahead, Christine.
I do think it's important for the public to be aware of an executive order that came down this week about testing in nursing homes. The residents of nursing homes are our most vulnerable population with COVID-19. And the governor feels that they are so vulnerable that he passed an executive order requiring that all staff of every nursing home and adult care facility in New York State must undergo a nasopharyngeal swab twice a week and be tested for the COVID-19 infection. That will now be a requirement for employment. So employees who don't want to fulfill that will no longer be able to be employed there. And facilities who don't meet that requirement will be subject to a fine of up to $2,000 per day per violation and are at jeopardy of losing their license to operate. We are working hard to try to assist as best as we can at the county level our nursing home and adult care facilities in meeting this requirement. The testing must start by next Wednesday. So to help bridge the gap that exists in both testing supplies and lab capability, though right now that would be an impossible task to test every single employee of every nursing home and adult care facility. That would be about 2,500 employees. So that's 5,000 tests per week for that population of staff alone. And as you just heard, we have tested about 2,000 people to date so far in this pandemic because of the lack of testing supplies. We will be conducting, in conjunction with County Emergency Services, drive-through testing for nursing home staff next week, Tuesday in the South County and Wednesday in the North County. My staff has been working very hard along with John's to pull this off and get people signed up in time to register. This is by appointment only, and we're looking at 20% of each of the facilities personnel will be eligible to be tested. So somewhat of a point of prevalence, little study of our own, I guess, that we're doing. But this will absolutely assist each of the facilities in starting to meet the new mandate that's come down from the governor's office.
Thank you. This time, there's a couple of things I would like to discuss. I'd like to address our county budget situation. As you know, yesterday I extended the state of emergency for Chautauqua County for up to an additional 30 days. But I'd like to make it clear this does not impact the governor's decision to keep our county under the pause restrictions he has implemented. Again, this also does not delay our county's ability to reopen should we be given the green light to move to phase 2. And again, I think that's important. The state of emergency declaration does not inhibit or prevent our county from opening should we be given that ability. This is simply procedural extension after the consultation with the COVID response team and our county attorney. And since Governor Cuomo has stated the Western New York region did not meet the criteria and is keeping pause restrictions in place, we need to ensure not only the county, but every town and village and city in the county is able to maintain eligibility for FEMA disaster assistance. The COVID-19 situation is very fluid and changes every day, sometimes several times throughout the day. I did not want to jeopardize disaster assistance for our municipalities or taxpayers, given the difficult budget situation we are now facing. I'd like to give a brief update on the county budget situation before we open it up for questions and time for our county attorney to address as well. The current COVID-19 coronavirus pandemic in the state of New York has resulted in an unprecedented economic impact to all businesses and public entities, including Chautauqua County. Because the COVID-19 pandemic is ongoing, the impact of county revenues is difficult to predict, but it is safe to say the county's budget sales tax revenue, occupancy tax revenue, and state aid will substantially be reduced. Having said that, in response and consultation with the county legislature's leadership, I have taken several remedial actions over the past month to offset the expenditure shortfalls arising from the COVID-19 pandemic. Much like the daily meeting of my COVID-19 response team, we have convened for the last 3 weeks our COVID-19 finance team, meeting twice a week, and those meetings will start to ramp up next week to 3 times a week as we move forward. Today, I filed a 2020 budget amendment resolution which will offset over $4 million in expected revenue shortfalls. This is in large thanks to the hard work and due diligence of our department heads and our financial teams. Other steps that I have taken include instituting a hiring freeze for other than essential positions, eliminated the use of overtime unless related directly to the COVID-19 response. We suspended purchase of new equipment or leases unless necessary to keep staff working or to respond to the COVID-19 crisis. We've required that all purchases over $5,000 be approved by the budget director and that all department heads reduce purchases under $5,000 to the extent possible. We began tracking all incremental expenditures related to the COVID-19 response for potential reimbursement from FEMA. Eliminated all unnecessary travel, including commitments for discretionary travel for the future, such as conferences. We directed department heads to delay any non-essential spending and contract for services, and to carefully monitor federal and state-funded programs for possible aid reductions. We also negotiated a memorandum of agreement with our CSEA Local 6300, dated today, May 15, 2020, to implement voluntary furloughs to achieve necessary reduction in budget expenses as an alternative to layoffs. When the savings from the furloughs are quantified, additional 2020 budget amendments will be presented reflecting the reduction in personnel expenses. This has not been an easy task and something that has taken a great deal of deliberation, but as the times are facing us, it is prudent to move forward and take appropriate actions to reduce the situation and its pain. At this time, I'd like to turn the microphone over to County Attorney Steve Abdella.
Thank you, County Executive. I will just echo his words in terms of the purpose of the local state of emergency declaration being continued is primarily to assure that, any funding source that we might seek, that we have the most support and documentation that we can have to justify a claim we might make. Similar to the county, the state has a statewide declaration in effect, and I would expect that to continue through all of the phases of reopening. It would be my recommendation that the county continue its declaration through all of the phases of reopening as well, again, to assure funding and also to underscore all of the public health efforts being made by DHHS and other players in this effort. Thank you.
Thank you, County Attorney. At this time, we're going to open up for questions from the media, and we'll start here. We do have some printed questions submitted from the Post-Journal. The first one is, could the county health officials expand on reports of its first case involving a pediatric patient?
We are not permitted to talk about specific cases or specific people. That would be a violation of someone's personal health information. I do feel that I am at the liberty to say that this child is doing well and actually was asymptomatic, never has had any symptoms of COVID-19, and is doing very well.
Another question, are thoughts and suggestions on reports of children elsewhere in the state becoming seriously ill with a rare syndrome?
There are those reports, yes, in other places of the state. We have not seen or heard of any of that around here. I don't know if Dr. Walters is on the line.
I am on the line. I think if you watch the governor's press conferences or in the media, you do see some reports of what's described as a Kawasaki-like syndrome or a toxic shock-like syndrome, which is an inflammatory type condition being associated with COVID-19. Now, all the details of this are not yet available as we're trying to look at the Department of Health and the CDC investigating these cases and trying to determine the exact cause and risk factors and things of the like. While that is true, and I think there's now just over 100 cases being looked at in New York State, and certainly concerning, I think it's also important to recognize, especially for all the parents out there, that while there are 100 cases, the incidence of this in children who are affected is very low. The number of pediatric patients who develop a severe course of illness requiring hospitalization or ICU admission is exceedingly low. And even if you look at the number of pediatric deaths in children under 20 years of age across the entire United States, that number of deaths as of April 30th was only 20 in the entire United States. So it's certainly concerning. It's something we need to continue to investigate. But I think that all the parents and public there should be assured that this is a very small minority of children who do get this manifestation, even if they do have the coronavirus.
There were early reports of this about a month ago, I think, in Europe. And again, this is a phenomenon which was identified, and again, in very, very small numbers. And it probably represents a one-off situation with kids who develop some accelerated immunological response to the effects of the virus. It's interesting that often this appears weeks after they've had the infection, and it's just an accelerated immunological or an inflammatory response which causes a variety of symptoms. We've seen it before in other diseases, and it's a well-recognized but very rare syndrome, and very, very small numbers, but very scary, obviously.
Thank you. Last question from the Post-Journal, with local legislators and representatives suggesting that Erie County not be included in the reopening metrics. Would the county meet all the criteria to be able to reopen some parts of the economy on its own, specifically the number of tests per 1,000 residents in regarding the contact tracing? As we've said before, the county has met these criteria and metrics, as everything else that could be impacted by increased numbers or changes in our caseload. But what is important is, yes, the number of tests and the capacity has been increased with that public and private partnership from Congressman Tom Reed and Quest Diagnostic and the agreement they have to have that testing capability. Also, in regards to the contact tracing, as you said before, Chautauqua County has 78 contact tracers. 53 have been very active throughout this entire process. So we are very capable of the contact tracing. I've said it before and continue. I feel our public health department is second to none when it has come to the contact tracing. So I feel confident in their abilities in mitigating this should we see an uptick or a cluster effect in our cases.
When we look across the 3 counties, that would come out to about 282 tests a day across the 3 counties, with the onus on Chautauqua because of population at about 140 tests a day. I fully will say we have not tested that many as an average. Just yesterday, we did test well over 100 people because of our initiative with the nursing homes. With the governor's own requirement now for nursing home staff, the supplies are actually available. Everybody will well exceed the requirements that he's put out for testing.
Moving on, we'll start at the top of the order today. Mr. O'Connor from Shawkat.
to Christine. How many people in the hospital?
Chautauqua County, we have one person hospitalized currently. Cattaraugus County has 2 and Allegheny has 0.
And you said the pediatric patient was not hospitalized and was asymptomatic,
The
Did I,
pediatric patient was asymptomatic for COVID-19.
so they just tested positive, but they don't have symptoms of?
Correct.
Okay. How many, if you know, overdose deaths March, April, and so far in May in the county?
I don't know those off the top of my head. Didn't prepare for that one for this press conference. I know there was 45 in the month of March, and I believe 4 more through April 22nd, but I don't know off the top of my head what's been since then, but I will get that.
I have a confession to make. Justin Gould of WNY News Now and myself yesterday prepared our questions jointly. And so I would like to turn this over to Justin, and then I will come back because, Justin, I believe you have more questions for Christine, right?
And in regards to that pediatric case, I just want to make sure that we have the right information. That child is not in the hospital then? They're at home recovering?
That child is not in the hospital, no.
And then, and I know the doctors mentioned it briefly, but what would you kind of say to parents in the community who maybe now hear, oh, this case is locally, and they're concerned?
I would say develop and use your common sense, that this is still a time to take care of your children. That if they're over the age of 2, they should have a mask when they're out in public and not able to social distance. This is not the time to take the children to Walmart or Aldi's to go grocery shopping. We want to decrease the amount of exposure that children have out there. Well, we do feel that children have been very resilient throughout this time, but there are no guarantees. There's still a lot we don't know about this virus and what its impacts will be. I think the common sense approach is the best for everyone right now. Teach your kids how to wash their hands. They know the happy birthday song. They know how to sing it twice. Have them wash their hands. Get after them if they're biting their nails or if they're touching their face or sucking their thumb. Now's a really good time to help to break some of those habits. Be a little extra diligent on cleaning the frequently touched surface, especially toys and things that children tend to put in their mouths. These sorts of habits, if we can develop them now, are really going to help us, not just during this pandemic, but from here on out with every other communicable disease that's out there, and especially those that we know really wreak havoc on our kids. You know, the influenza, the pertussis, the hand, foot, and mouth disease, and so many other things that our children go through with some extra hygiene measures can really help to prevent.
And I talked to Jamestown Public School Superintendent today about the conversation that they're having, I think, probably all over the country of what are we going to do this fall when it comes to reopening schools? What will that look like? From a public health standpoint, what's the number one concern if kids did go back to school the way that we did before? And what do you recommend to them in that regard?
Number one concern. Guess if I'd have to pick one, I would say that schools are a place where kids congregate. We have to be diligent to try to keep that to a minimum and to make sure the surfaces are cleaned, that there are adequate tissues and other hygiene measures, hand sanitizer, and try to keep our kids healthy so that they don't go home and get mom and dad and grandma and grandpa or the newborn baby or anyone else in the household ill. Dr. Burke has been a school physician. I don't know if he has anything to add to that.
I think the problem that we'll face, of course, is that the older kids are going to be the easiest kids to deal with because you hope that they can understand the messaging. As you get down into the really young ages, and my wife is an early childhood expert, and we were just talking about this on the way up here this morning. young kids, by nature of the way they interact, are all over each other, and that's part of their social, they're learning, and that's going to be the difficult part, is the preschoolers and the kids in kindergarten. They're much more tactile, a touchy feeling, and they're using manipulatives, and that's what they should be doing. That's how they learn. And they can't sit at a desk all day. That's a model that just doesn't work for these kids. And so we're going to have to get very creative on how we manage the very, very young ones to keep them safe, yet let them learn in the ways they have to learn, which is exploring their universe.
Do you, Dr. Burke, have an idea of what we could do come September?
It's going to be challenging. On one hand, again, we're a very low prevalence area, so the risk is a lot lower, but it's not zero. And I think the educators can get creative enough to create environments where the kids can get the education they need. And a lot of people are very fearful that these kids being out of school for so long and the teleschool experiment is kind of very tough. These kids need the socialization skills. They need to interact with each other. Their parents definitely need them out of the house to burn off energy and whatever else, and to interact with other kids. So this is going to be a very, very good lesson for the school systems to work on a problem for them to solve, and solve in a way that they keep the kids safe, but they get the kids educated and give them the experience they need to become healthy, growing adults without a great gap in their learning experience.
A question for either Dr. Burke or Ms. Schuyler. In regards to COVID-19 deaths here in the county, we've seen not that many compared to other regions here in Western New York and across the state. Do you have a testament to why that is?
Well, I think the amount of deaths we've had is correlates somewhat with the number of cases we've had. We haven't seen a high prevalence of disease here, and those who have died of disease throughout this pandemic have had, for the most part, have had similar characteristics. They've been elderly. I believe the average age is like 80. So you're elderly. You have a lot of comorbid conditions. We're seeing, a lot of heart disease, lung disease, diabetes as underlying conditions. So I think that just goes hand in hand with what we're seeing with the prevalence of the disease.
And the reason it'd be lower is because we haven't had as many cases. I know that Governor Cuomo's part of his order is he has said that he's very concerned with nursing homes being a place where the disease can spread rapidly. But for the most part in Chautauqua County, we haven't had a problem really up until this week with a facility in the North County area.
Yeah, and we still have not had any reported positive cases of a nursing home resident or an adult care facility resident in our county. We're very fortunate of that so far. A nursing home, while it is a resident new home, it's also what we call a congregate care facility. So if we were to take a home where you have a lot of children in, that's a congregate care facility. And if you have a disease like hand, foot, and mouth, you're going to see it spread very quickly wherever people are in close quarters and they're sharing, whether it's staff or whether it's utensils or equipment. We will see disease spread faster in any of those areas. So it only makes sense when you've got a population of elderly with underlying health conditions who are living in a very confined space that you see more disease spread.
And I know yesterday Absolute Care of Westfield said that they had an employee who tested positive, but no one else at the nursing home has tested positive. Is that something that the county's monitoring?
As the local health department, we monitor all cases, all positive cases of COVID-19, and do the contact tracing, the case investigation, and everything that goes along with that. Anytime that there could potentially be an incident within a facility that's licensed by the New York State Department of Health, such as hospitals, diagnostic and treatment centers, and nursing homes, the state health department also monitors what's going on within that facility.
Do you anticipate any sort of intervention on that part, or is that something that the facility tries to work out on their own with these precautionary measures?
Whenever there's any sort of a reportable disease present in a facility, between the state and the local health department, infection control procedures are looked at. The use of proper protective equipment is looked at. And of course, any contact tracing or what needs to be done to mitigate the spread of disease within a facility.
I think what we've seen nationwide is that there was an early high death rate in a number of nursing homes that were totally unprepared for this kind of novel infection. I think what we've seen locally since we've been meeting, and I know Christine has had numerous contacts early on with the nursing homes, they've ramped up their infection control, their use of PPE, and this has mitigated to a great extent nationwide, but here we know, because we've been in contact with these folks, their risk has dropped significantly. The early reports, and we've all seen them, they're tragic, of this running rampant through nursing homes in Seattle with very high mortality rates, that veterans home on the East Coast where they had a huge number of deaths. This was before anybody really understood what was going on or was prepared for it. I think that here, in our discussions with the management of the nursing homes, they are being really, really careful and are actually beyond careful with respect to how they're managing this. And that, in a sense, has probably led to, along with low prevalence in the community, no residents being infected. And again, it proves one thing: if you take the necessary steps and you know what you're doing, you can effect change without the use of one drop of medication, one vaccine, anything. It's just common sense and good housekeeping, basically.
And then for me, I just had two more questions for County Executive Wendell. We had a few people reach out to WNY News Now this week and last week over Mother's Day, who were concerned because they saw some businesses operating like flower shops who weren't necessarily deemed essential and selling flowers, and they just felt like that wasn't necessarily fair for their business. At this point, New York on pause still in effect here. What do you say to those people out there who have skin in the game, who say, I don't feel like violating an executive order, but at the same time, I see my competitor down the street open?
I think the first thing to do is reach out to the Empire State Development Corporation, ESD. They do have guidelines. Most of those, or some, could have received a waiver for various reasons through ESD. As far as flower shops, I'm not particularly aware. I haven't received anything. We do, myself and Sheriff Quattrone, get every pause task force complaint that is filed. It does come to us electronically, and then they are disseminated out to the local law enforcement. Also, there is a forward.ny.gov, and that is a new website to look at what businesses will be able to be open on phase one. So I urge individuals to look at those two areas, ESD and the new New York Forward, to get better clarification on what those businesses are and what ones are able to be open.
And then in regards to your cooperation now with Cattaraugus County that you talked about at the top, trying to urge state leaders and regional leaders to consider us to be a different district. Is there a process for that? Are you going to wait for the state to say, yeah, I like that idea, let's do it? Or are you just going to do it?
Well, what we're going to do today, I just got off the phone with John Majori from the governor's office prior to this the conference. We are meeting with them. That's why I do have a hard stop at 4 o'clock today. I'm part of the Western New York Control Room. Lieutenant Governor Hochul is there, and I spoke with John at length today as to our plans moving forward. He has been very receptive, and so has the governor's office, to the questions we've asked and situations we've brought forward. So we're going to move forward in that manner, bring it up today to our control board and look. There have been some questions Erie County's raised as well as to their metrics and where they are. So we're going to urge things to be looked at a little bit more closer and closely. And again, because we provide such a unique experience in that our residents can travel quickly to other areas, and we do not want to lose our economy. And, moving forward in this matter is in concert with Assemblyman Goodell and Senator Borrello's plan that has been put forward also, looking at our region a little bit differently. And again, now this sub-region, based on our low population density and the uniqueness our three counties pose as compared to the Western New York group we're linked with.
The graphic that you had today, was that something that Chautauqua County put together, or did the state do that?
The state has the graphic. We plugged our numbers into it. It is a state form or a template that they're using, and then we've put our numbers into it to show where we stand as far as the metrics go.
Okay, that's it for me. Thank you.
Yep.
BJ, since you have to leave at 4, have you instructed the county attorney, or do you contemplate instructing the county attorney to contact the attorneys in Cattaraugus and Allegheny County? I presume you'd have standing to bring suit against the state of New York for perhaps irreparable harm. Have you decided that that's what you'll do if they don't let you have the sub-region, just sue them?
We did for the first time have discussions today amongst the county attorneys just to discuss the options, but there's been no conclusion yet on what the county's available legal options would be.
Do you believe you would have standing to sue them?
That's a difficult question. It's often the case that counties do not have standing in similar situations such as this.
Thank you. PJ, can you tell us anything about Lilydale and Lucy Fest? Have you heard from the people there?
I have not heard from anybody from Lilydale. I did have a resident call me early on with some concerns about their business and the lack of residents they'll have in, I believe it's a bed and breakfast. I have not heard anything from Lucy Fest nor the Comedy Center as we move forward.
And finally, since I know you have to leave at 4, why no, what was Lieutenant Governor Kathy Hochul, who I don't believe has any medical training, if she does, I'm not aware of it. Why is there no medical person on the control room board? Isn't that, to use a word, absurd?
Again, those are the boards that the governor's put forward. I know that Lieutenant Governor has been well informed of my group and what we bring to the table as far as our medical background. Many others, I know County Executive Poloncarz and his medical team are part of that. As far as individuals on the control board that are medical professionals, I don't know why they didn't do that, but I know we are in direct contract with our medical personnel through each of the 2 county executives groups.
Does that include the epidemiology department at Jacobs School on UB campus?
I can't answer that. I'm not sure exactly who's part of their group.
And so Lieutenant Governor Hochul has no answer for why there's not a medical person actually on the control room?
I don't think the question's been asked. I can ask this afternoon.
Does the control room have any real control? It sounds to me like, Governor, this is a cat's paw for the governor. You can't say we in the control room are going to open our region. Only the governor can do that, right?
As we're told right now in phase 1, yes. As we move forward, that is changing. We're not sure exactly what the parameters will be in the capacity of the control group, but right now that control room is going to be looking at the data as we do start to get into phase 1 and looking at the hospitalizations, mortality rates, et cetera. So all of the data that's coming in will be observed by this group and decisions will be made as we move forward. But as far as exactly what we will be able to have input on, that has not been expressed yet.
Christine, of the 4, I notice now there were 4 deaths listed, and then when I look at the New York statistics, it says 3 deaths, and today you mentioned 3 deaths in Chautauqua County. Has one of the deaths been removed?
No, it's 4.
It is 4?
I think it's 4
Okay,
count.
New York's-
Remember, it's your, all the data goes by your county of residence.
Right, I
So
looked it up. In
even
New
if-
York, it's 3-3, their statistics. 3 county of residents, 3 died in the county.
Well, yeah, the way that the New York data comes, it's batched differently out of the state systems. When we have our data here, we have already gone through and verified the county of residence and who is where, and that hasn't necessarily happened in the data you see from the state. That's why there can be some minor discrepancies between what a county reports and what the state is reporting. We go through and we actually mine every single one of those cases and see where the county of residence is. I mean, even on testing, that you could have somebody who is helping out with the cause in New York City, and they become ill and they get tested in New York City, and they haven't stepped foot in Chautauqua County for a month, and they aren't going to for a few more months. But that counts as a positive for Chautauqua County because they're our resident.
And one gentleman died in Olean General Hospital.
That I don't know the
He was listed in Chautauqua County.
Oh, that I don't know the specifics of an Olean
You said,
death.
though, of the 4 deaths, all of these people are in that vulnerable group, over 60 underlying conditions.
I believe so. I don't want to make sure on the age because I don't remember ages of everyone, but everybody has had underlying health conditions and has been in that high-risk population that you would expect to see.
So what Dr. Yealy of UPMC said May 7th, I presume you've all looked at that now since last week, is true, that we now know with exactitude what the vulnerable population is. For example, he said there's no reason why schools, this is the head of emergency services at UPMC putting his reputation on the line, there's no reason why schools can't reopen. Children just are not vulnerable to this disease.
I mean, he can put his reputation on the line, but I honestly am not ready to put my reputation on the line because there's just still too much that we don't know about what this virus is going to do.
Emergency services.
I didn't
He's
realize
written
that.
books. I mean, his
That's great, but if you're going to try to get me to say that same thing, I'm not going to because I think there's still enough.
So you feel your credentials are superior to his?
This has nothing to do with credentials. I am saying there is a lot that we do not know about this virus because it is novel. So I don't think we really know exactly what's going to happen in children until we get children all together again and see what happens. Because this virus isn't going away. It's not like
No, he said it isn't going away.
It's not going to. Dr. Burke?
There's one other piece that we have to consider here. These children do not go back to homes that may not have elderly folks in them. They may be in multi-generational homes. They may turn out just to be the vector of illness for older folks, and that's what we're finding. I think Governor Cuomo noted that a good percentage of the folks who died in New York City were folks who never left their homes. And you would think they should have been out circulating to get sick, but they got sick because someone brought the illness into the home. So I think one of the concerns with children is that they will become asymptomatic carriers and go back into homes, especially homes where there are conditions with large numbers of folks in poorer situations, and then bring illness in. That's all. I mean, these are issues that have to be contemplated. It's not a question of Christine's credentials and Dr. Ely's credentials. It's a question of issues that have to be thought out past just what appears to be, very simple issues that these kids should be in school. Of course they should be in school, but we have to be concerned about what happens as a result of that. That's all.
Moving on, we'll reach out WDOE, Dave Rowley.
Well, we're thankful to allow radio to ask a question or two. We did want to ask about the 3 counties working together. Can you be a little bit more specific about maybe your goals and who is involved in working as a sub-region?
Today we convened a meeting at 12:30. It was myself, the county administrators from both counties, the attorneys from the other remaining counties, and also the chairman of their legislatures. They do not have an elected county executive, so we went to the administration and their elected official and their attorney. In the case of Allegheny County, their administrator was just recently moved and promoted from their county attorney's position. So that's the person we've contacted, myself and Steve Abdella. So we will work in concert with those groups. We've also reached out to our public health directors asking for their input as we're looking for credible scientific data and the medical data moving forward based on sound information moving forward as we look at this. It's going to be ongoing. We're going to discuss it more. I know Jack Searles out of Cattaraugus County is going to be putting out a press release today, and we are bringing this up. That's the urgency for the control room meeting today at 4 o'clock.
Okay, thanks, PJ.
Move on, WJTN, Terry Frank.
Yes, good afternoon, folks. Dave asked the question that I was thinking about, but I did have another one because the governor has mentioned numerous times in his press conference calls or press conferences briefings that this disease, this virus has been disproportionately hitting minorities, including Hispanic communities. And with a number of cases reported in Battalion 1, the North County area, I was wondering if the large Hispanic population up there has been disproportionately hit by this.
I don't think we could say disproportionately hit in our county. But knowing the demographics of our county, I think so far our cases have probably been in line with what you see as far as the percentage of demographics we have, if that made sense.
Okay, yeah. Thanks, Christine.
Anything else, Terry?
No, I'm good.
Okay. Well, again, I'd like to thank everybody for our weekly press conference. We will convene this again next Friday. Again, we're reminding everybody, stay home, stay healthy, and we will remain CHQ strong.